Welcome back to the Healthy Commute. I'm Dr. Dan. I'm with Dr. Pascal. Today we're going to talk about whiplash and the 5 key things to understand to make sure that you're able to recover and heal properly after a whiplash. And the reason why we're talking about this today, we're taping this at the beginning of November. We've got some light snow falling outside. The streets are getting slicker. There's definitely more accidents happening. So we just want to equip you to make sure that you know everything you need to know about whiplash.
Perfect. So step 1 is, I think let's just really describe what whiplash is, because I think there's a little misconception there. Sometimes people think whiplash is an injury, but whiplash is not an injury. It's not like, I have a sprain. Whiplash is the way in which you received a sprain to the neck, or you received a subluxation to the neck. So whiplash is really a type of injury, not the injury itself, okay? So when you're in a car accident, whiplash means your spine goes forward and backwards, and that mechanism of going forward backwards is what causes the injuries to the spine. And those injuries could be, at the level of ligaments, tendons, muscles, joints. So all of those support structures can be damaged, okay? So whiplash can cause multiple levels of damage to a joint, okay? And it doesn't have to just be a car accident, Dr. Dan.
Right.
People think of whiplash when we discuss it because, automatically we associate it with slippery roads, car accidents, but someone that falls off a snowboard on a jump, or someone that, falls off a bicycle, any of those injuries where, your spine or your body has the ability to whip one way and back the other can cause whiplash type injuries.
Off a trampoline, on the ice, hitting
Yes.
the boards, falling like backwards, slipping on a sidewalk, and then your head kind of flips back and forth. So there's a lot of different ways to receive that whiplash. But the key thing in terms of the damage that the whiplash does is it affects the stability of the spine. Right? So now if we have these supporting structures that are now not able to support the spine properly, there's more damage or risk of injury to the spine. So think of it almost like if when you were younger, you were playing out in the field, there was a hole, and you kind of rolled your ankle in that hole, and you were injured, you felt it, and you were maybe hobbling over for the next week or so. But now any prior or any next injury that you may have when you're slipping off a sidewalk or something, which ankle are you going to now feel it or have the most amount of damage? Is that prior injury, because it's not able to properly support that structure. So that's what a whiplash can do to your neck and really start to cause injuries for the rest of your life.
And so when having said that, what we need to understand is the more we can do following the injury with help from the outside, the better the long-term outcome is. Meaning that rolled ankle, there's a difference with how that person's gonna recover, Dr. Dan, if they don't do any sort of what we call rehab versus if they do a lot of it, right? Yeah. And so, another example that I love that you often give to people is the example of the broken arm. So if I break my arm and it's shooting out the side at 90 degrees, my body can't heal that injury on its own. And so even if I leave it there and eventually the pain goes away, is there still a problem with that arm?
Without a doubt.
Without a doubt. But as soon as I break it, if I go and see a great surgeon, they put a cast on there, put some bolts in, and now, my arm is properly lined up, can my body now heal those tissues like they were supposed to, so that once the cast is off, my arm can then go back to functioning normally?
Yep.
Yes. And so whiplash is what happens when the spine gets what we'll call destabilized, it's out of position, and unfortunately your brain or your body on its own cannot fix that, and we really need help from the outside to put the spine back into proper position so that you don't develop these lifelong problems.
Right.
Okay, so let's get into the 5 bullet points of what you need to know about it.
Yeah, so number 1 is it doesn't take a lot of force to cause an injury.
Right.
So
people think that, often we hear this quite a bit when we're going through, past history with people. They say, oh, I was in a car accident, but it was nothing, doc. And, we always want to know, tell me about it, because we know that anything above 13 kilometers an hour, a study done by Yale showed us that above 13K an hour, you're getting whiplash or soft tissue injuries to the passengers.
So when we talk about 13 kilometers an hour, that is nothing. Right? When a lot of times we think of a car accident as, okay, well, there has to be, massive damage to the cars, the airbag has to go off, but 13 is literally you're waiting on a yield, and the car behind you just, they think you're going, you're not, they bump you, right? Yeah. And that is enough to cause ligament damage to your spine.
And then part of the reason, sometimes, people want to ask us, or they think, well, how can that be possible? How can such a small car accident cause that kind of damage? Well, you have to understand that cars, their safety designs are to have them crumple on impact, right? Or the airbags deploy, and that's so that that force from a multiple 100-pound vehicle hitting you doesn't transfer to the spine. Well, sometimes those 30k/h accidents have no damage to the bumper, the airbags don't deploy, so that force that came into the car has to go somewhere, and it's transferred to your body. You know, you go forward, you go backwards, and even though it wasn't very fast, you result in having a whiplash injury, whether there's pain or not.
And that's the key thing, is for most people, is we equate the level of pain to the level of injury, right? And that could really steer us down the wrong road, because a lot of times there is zero pain even though there's an injury. So yes, symptoms could help us, direct us and go, okay, yes, I need to do something about it. But even worse is when we don't have any pain. So then we therefore go, okay, well, I guess I'm fine. I don't need to do anything. But that injury just progressively gets worse and worse and worse over time, kind of almost like a little cavity that was found as a 12-year-old. And then now, 20 years later, it's just destroyed, you know, that tooth. Same kind of thing could happen to your spine.
And oftentimes that happens to us, again, whether it's a car accident or a slip fall, a fall off a trampoline, these injuries, because they don't cause pain when we're young, stay there, and then they will break down our spine in the background without us knowing over time. And then that leads us to bullet point number 2, which is aging then increases the risk of injuries. So, you know, if you've had an underlying problem building for 30, 40 years, and then you're in another car accident when you're 55, well, that spine that's been injured for years is more likely to be re-aggravated or suffer more problems the second go round. Does that make sense?
For sure. And a lot of times we get that question asked from patients, that they say, okay, doc, so what caused me to be in the state that I am now?
Right.
And it's not, and yes, sometimes there can be some major kind of accidents that person has been under, but a lot of times it's just kind of layers and layers and layers of little things over time. Posture issues, slips and falls, sleeping issues, stress, car accidents, sport injuries, all those things kind of pile on. And now, let's say you're 40, 50, 60 years old in a car, and someone, you know, kind of, you know, hits you from behind at 20 kilometers an hour, right? So all those things kind of pile up and cause you to be in the state that you're in. Same kind of thing as asking the dentist, hey, what caused my cavity? Well, it's not what you had for dinner last night. It's all those things that have happened before.
Right.
Maybe the lack of dental hygiene, the sugar, all those things pile up over time that cause that cavity or that injury to your spine.
And so if you are in a car accident, let's say, you know, maybe you are, and then you're in the car with your kids, and, you know, so you're maybe 40-something, 50-something, and you have pain and they don't. But again, you need to get them checked while you get yourself checked out, because you don't want that same progression to happen to them, right? Exactly. And so, you know, 2 people can be in the car, and one comes out feeling like they're fine, and one comes out feeling like they've been, you know, beat up, but both people can have suffered whiplash.
Yeah.
Okay?
Number 3 is you shouldn't shrug off symptoms. And obviously we just talked about this in terms of the level of pain. Just because you have no pain does not mean that you don't have any symptoms.
But if you do have pain, oftentimes can mean that the injury is worse or more significant, right? So pain is also a good indicator that now there is a significant amount of whiplash damage, okay? And we were reading some stats there from some of those articles before doing this podcast, and there's some staggering numbers. So if you do have pain, so anybody that suffers any type of symptoms or pain from a whiplash accident, 50% of those people, so 1 in 2, is gonna have lifelong chronic pain. 25% of those, or 1 in 4, is going to have lifelong disability, meaning their life will be limited by the pain that they suffered from that whiplash accident.
Yeah,
okay,
that's staggering.
It is. And so, you know, what we want you to understand by this is that, okay, maybe, you know, at first you have the pain and we kind of think, no big deal, it's going to go away on its own. That's not correct. So even if that pain disappears later on, the injury hasn't been corrected. So whether, you know, you're taking pain meds or you're doing something now to try and manage your pain, you also need something to address the injury, not just the symptom. Because once that pain is gone, if the injuries aren't properly addressed or corrected, you are still going to be predisposing your spine to more breakdown and more problems later on.
Yeah.
So any type of symptoms, get them checked, get them addressed right away.
Yeah. Number 4 is, when it comes to whiplash, rest equals rust.
Yeah.
The key thing, and maybe this is maybe a little bit of an older way of thinking, is, okay, so I'm injured, I just need to sit on the couch, not move, because I don't want to make the injury worse. And really, that's almost the opposite of what is needed after, especially a whiplash injury.
Right. And so, we're not telling you go out, the 2 days after your significant car accident and go start, doing barbells and throwing things around and doing these movements that are causing you significant amount of pain. No. We're telling you your body needs to move to help rehabilitate these injuries. So things like, just brisk walking, light stretching, neck range of motion or low back range of motion, where you're taking that portion of your spine through its normal motions, trying to find the point where it hurts and maybe pushing past it just a little bit. So you're getting uncomfortable, but you're not causing yourself significant pain. And part what happens there is we help to properly rebuild the tissues. You prevent scar tissue buildup. It also teaches your brain that it's okay to move, because the longer you stay immobile, the more swelling, the more pain, the more your brain thinks it's going to be a problem to move it, and then the harder and harder and harder it becomes to recover long term.
Yeah. So rest equals rest. We need
you to get moving.
Yeah. And number 5 is, what should I do if unfortunately I find myself, that I had a car accident, right? So number 1 thing we need to do after that car accident, let's say, you just got hit, is we need proper documentation. Now this is more like, all the filing and all that kind of stuff. We need proper documentation, especially from, the other driver.
Yeah, and it's mostly just to protect yourself. And whether or not you think there's damage to the car, there's damage to you, document it. So take pictures of the vehicles, the license plates, get a witness if possible, get a witness testimonial, because you never know what can then change 2 weeks later, 3 weeks later, so on and so forth, even years later down the road. So,
and I can't stress the witness enough. I know it's happened to me in the past, where the other driver said, "Oh no, it's my fault. I'm the one that hit you." So I was like, "Oh great, this is going to be easy." But then when they came to filing, they said I backed into them. So you always need to, you can't overdo the documentation part of it. Get your witness and take a picture of everything.
Well, according to this bullet point as well, in addition to, we want you to ice an injured area immediately after it happened. So as soon as you've documented, and whether you're now at work or you're at home, ice any affected area. So if you're feeling an area right away where it hurts or it's stiff, take an ice pack, put it on there for 15 minutes, and repeat that every 2 to 3 hours. Super important to do that within that first day, is to ice it as many times as possible to help reduce pain, inflammation, and that'll help the healing process.
And what I like to tell patients is almost think of it as a on the hour kind of homework, right?
Yeah.
You ice, let's say for 10 to 15 minutes, and then you move, just slight stretching, just to keep that, and then as the top of the hour, you just keep cycling through that, just to kind of help you, especially in that first day after the accident.
Perfect. File a bodily claim injury with MPI. Again, whether or not you feel pain doesn't mean you weren't injured. So just to be safe, you get your injury or your claim number for the car, or the damage that was done to the car, but you need a separate number for your bodily injury. And so, get one of those right away if you're in an accident, just to have, and then if you don't need to use it later on, fine, no problem. But it's better to have it now than try and reopen it 6 months down the road when you realize that now I'm suffering whiplash injuries, even though they didn't hurt me then. 6 months down the road, now I'm getting severe neck pain, severe back pain, all these types of issues, and it's harder to claim it later on, saying that the injury caused them, right? We see that quite often with people.
Yeah. And the last thing in this kind of point here is definitely call your chiropractor, get a checkup, understand, and get that spine evaluated to make sure, is there an injury? Is there damage to those ligaments and muscles, to make sure that there isn't long-term damage associated with that whiplash injury.
And the sooner you can do that, the better.
Yep.
So it's same day of the accident or the next day. Don't wait a week, don't wait 2 weeks. Get checked right away.
So as a quick recap, number 1 was it doesn't take a lot of force to create that injury or that whiplash. Number 2 is aging can also increase the risk of that whiplash. Number 3 is you shouldn't shrug off symptoms, whether you feel 0 pain or you have a lot of pain, take care of it. Number 4 is when it comes to whiplash, rest equals rest. We need to move. And number 5 is what should we do? We talked about documentation, icing, and then file a bodily claim injury, and obviously call your chiropractor. So hopefully that helped you understand the do's and don'ts of whiplash injury. Hopefully that helped, and we'll see you next time on The Healthy Commute.
Have a great day.